Hello, everyone. Welcome to the Addicted Mind podcast. My name is Duane and I'm your host, and we are on to another episode. Our guest today is Meghan O'Neil, and Dr. O'Neil studies vulnerable populations in America, particularly focused on racial and economic inequality and how these mechanisms impact health and well-being. She conducts evidence-based research to make for better public policy. Dr. O'Neil holds an MA in quantitative methods from Columbia University and a PhD in sociology from SUNY Albany. As a research faculty at the University of Michigan, funded by the National Science Foundation, she created and implemented the Removing Barriers experiment in opioid treatment centers. She is the first generation in her family to attend college and is the granddaughter, daughter, and sister of wartime U.S. veterans. And she herself has been impacted by premature mortality associated with alcohol and drug misuse. And this drives her passion for informing better public policy for this vulnerable population. So Meghan is going to talk about her experiment, a randomized controlled trial, removing barriers to recovery, community partnering for innovative solutions to the opioid crisis. It is really amazing what Meghan was able to accomplish with her team to put this study together and to really be able to see the impact of how we can help this vulnerable population get recovery. I could really feel Meghan's passion for this work, that it touches her deeply and her heart is really in it to help all of these individuals who are struggling with substance use disorder. So I think you'll get a lot out of this episode. And if you're getting a lot out of the Addicted Mind podcast, please leave a review in iTunes or wherever you get your podcast. I do read them. They mean a lot to me. Thank you so much for all the people that have taken the time to do that. It really does help the Addicted Mind podcast get found, and I really appreciate it. All right, everyone, stay tuned for this episode. I want to welcome Meghan O'Neil to the Addicted Mind podcast. Welcome, Meghan. I'm excited that you're here. We're going to talk a lot about the research you're doing on addiction and addiction treatment. But first, let's just have you introduce yourself. Tell us a little bit about you and why this work is important to you.
Thanks for having me, Duane. I am just really excited to be here. I am a research investigator at University of Michigan, where I've been conducting research for about 5 years, a couple years with Michigan Law School and also with the Institute for Social Research. And I'm really focused on inequality in America and public policy and looking at vulnerable populations. And the past few years really been focused on people who use drugs and the circumstances that they're dealing with institutionally, whether that be healthcare, justice system, housing market, sort of the barriers and institutional issues that they face in trying to enter recovery and move on with their lives. And as somebody who's really interested in public policy, there's something to keep in mind with great American public policy, and that it often doesn't reach the people who need it most.
Right.
And so throughout the past few years, I came across some opportunities where I felt that I was able to connect with people who really needed these services and sort of link them up with these amazing opportunities that were publicly available that simply people didn't know how to access. And so really excited to share more about that and get into the nitty-gritty of the research and why it matters and why I think people should care about it from a public-facing standpoint, as, you know, not just academics like myself, but also policymakers and clinicians and community members who are concerned about the opioid crisis and the burgeoning addiction issues we have in America. So yeah, happy to talk about that. And just know I'm also moving in a couple of weeks to Ohio State and going to be working with their drug enforcement and policy unit at the Ohio State Law School. So excited about that.
Wow, that's a lot. So what motivated you to get into this field? Because these are very specific issues that you see, and it sounds like there's a real passion to dig into this piece of, you know, how do we help people? How do we help these vulnerable populations that are stuck?
Sure. Well, I studied sociology when I was in school. I was double major with special education and sociology. I was always very interested in vulnerable populations. And while I was studying sociology, it just sort of clicked with me. We had a class that was taught by a retired police detective, and I just found crime fascinating, especially coming from a working class neighborhood just outside of New York City, where a lot of people's family members, including my own, had been incarcerated. I grew up with a household member who was incarcerated on felony charges, began, their incarceration stints when they were a juvenile. And this is something that really impacted my life growing up, is to sort of see the system from that standpoint of a family member of someone who was visiting prisons and got to see firsthand, I guess I would say, or secondhand, as the family member, not the individual who's incarcerated, but as someone who, as a child, I grew up, visiting prisons and looking around and seeing the very blatant, obvious racial disparities, for example, and then economic disparities. So the people waiting in line to see their family were in large part poor Americans, right? And more often than not, they were people of color. And so these sort of issues that were plaguing our system were very apparent to me as a young person, probably, sooner than they would have been for other folks. And then as a sociologist, I learned to study things like demography and looking at neighborhoods, right? And if you live in this neighborhood, your likelihood of being picked up by the cops is X amount times what it would be in this other neighborhood, right? And then if you grew up in this region of the country, in this specific community, your likelihood of completing college is so much greater than someone who went to school in that community. And so looking at things like that demographers look at and trying to take, communities, neighborhoods, households, and break it all down and see where are the paths to prison? Where does this pipeline begin? Why are the people who are in prison, how did they get there, and why are they there and not the people in the other neighborhoods and not the people in the other households? And so I really tried to understand and take it all in and dissect it and figure out, what can I take from my academic teachings and everything I've learned about public policy and sort of social policy. What can I do to better serve the people where I came from, whether it be immigrant community or just a very, diverse neighborhood? How can we better serve these people so that they can move on and support their children and we can have intergenerational mobility instead of what was really interesting to me as a kid is I saw this path where men went into these labor positions that were often unionized. And although they were working poor, they were able to support a family along with a spouse and sometimes multi-generational. So grandparents may be in the household contributing and sort of working their way up in what was the American dream and the hopes of hopefully starting a better life and their children would have a better life. But once young men became incarcerated in the neighborhood and people were being incarcerated at younger ages for more severe drug charges and things of this nature, like the Rockefeller drug laws we saw in New York, where people had a certain amount of crack cocaine on them and would go away for a mandatory minimum of so many years. What happened is that these young men were going to prison when they were so young. They would come out and they were no longer eligible for employment in the industries where their fathers had worked. And so in the past few decades, I've seen this massive fallout where the primary bread earner in a lot of these families is no longer employable, right? And so we have this whole underground economy and we have a lot of people who are sort of forced into indigence and unable to form families and sort of not have the capital to get a mortgage, not to have the stability to get married. And so you see this sort of compounding issues surrounding poverty and discrimination. And it's very concerning to me because I see people in my own family, in my own community, who are unable to support their household and make their children's lives better than their own, which was all, everybody's American dream is to move forward and leave something better for your family. And so this very much I see is a policy failure. And I'm seeing that incarcerating young men for some of the things that they're being incarcerated for on these very, very serious charges is it's creating these sort of catastrophic community-based failures where we have people coming out under government supervision where they are obligated to test for drugs daily, right? And maybe the drug testing center is 40 minutes from their house and they also don't have a license because they've been incarcerated. Maybe their license is suspended. And so how do they get to the drug testing? And then how do they pay for the drug testing? And so
also, I was just going to say that they also become invisible to all of this. Like it's not seen. And so their struggle is just put upon them in a way that minimizes the real hurdles that they have to overcome. Just from my own experience, when I was working in this field, I worked in, it was in California in the Prop 36 program, which was a mandated program for drug offenders to do that in lieu of prison time. And I mean, my experience, like it almost felt impossible for them to complete this course with all the barriers that they faced. It was just like, it wasn't about recovery to me in some ways.
That is exactly what I'm talking about. And so my interest as a scholar is really to better serve the people who need it with evidence-based policies and influence the policy field such that we are not making policies that are well-intentioned, but they in practice fail, right? We want policies that, yes, you have this well-intention of keeping, the household drug-free. Great.
Right.
That's great. However, if it means that this person is going to lose their job because the time of the appointments interfere with 9 to 5 when they have to work, if it means that they're not able to be in the household with their children and then not involved in their families day to day and have those social relationships and familiar relationships that support recovery, and sometimes I see a lot in my experience in field work and clinical work that these somewhat, seemingly well-intentioned policies are undermining the actual structures that support recovery. And so what we're seeing is really a revolving prison door where a lot of these folks, more often men, but also women, and this impacts everyone, not just white folks, not just Black folks. This impacts all Americans who come through a justice system. The burden of oversight from the government is so high in people's individual lives that it ends up ultimately, we see often undermining recovery. Yeah. And so really what I tried to do with my experiment, removing barriers to recovery, was to work directly with community-based organizations who are serving the community well, right? And serving very vulnerable community members extremely well. And their success rates, are pretty good in the sense that they are meeting people where they're at and giving them what they need, right? So if they need help getting their license back, for example, they have recovery support specialists. And so policymakers don't think about these nitty-gritty things. They think, have this individual show up on this date and meet with their parole officer, and that's it. No questions asked. But for the individual who's been incarcerated and does not have access to transportation and perhaps is unemployed or underemployed, these are really high burdens that actually in themselves create a pathway back into incarceration because they're unable to comply.
So one of the questions that's coming up for me is like, how did you organize this study? I mean, it just seems so huge. One of the things that I've seen in that work when I was doing a lot of that work was like all these different agencies working in different directions and trying to coordinate that kind of partnership. It was just really, really difficult. So the first thing I'm like thinking is like, how did you organize this and do this study so that these partnering organizations could kind of come together and figure that out?
That's a great question. It took a lot of time and a lot of energy, and I was happy to do it. And I really sort of just threw myself into it. And I had a traditional postdoctoral fellowship offer when I was graduating with my PhD, which would have led me in a different direction. And it would have provided more stable employment at the time. And I chose instead to find my own research lab, basically to pursue this line of research because I was passionate about it, even though it would potentially be quite a bit of work or more work than the more obvious option for me to take. And so I just basically threw myself into it, and I made relationships and fostered relationships in the community. And I asked for a lot of help. I asked for help from senior faculty members. I asked for help from community members, community organizations. I cold called a lot of people in a lot of places. And I very much immersed myself in the local recovery community to find out who the movers and shakers were and who I needed to listen to, who I needed to speak to and ask for help. And my goal was essentially to help provide some publicly available services directly to people in treatment centers. And specifically, what we provide as part of my experiment is online court resources. So there's essentially a website with portals to different courthouses. The judges on the other end will see the communication, and individuals can communicate with the court without actually going to court. And this is a major hurdle for people who are on the lower end of the income spectrum, who come into recovery, sometimes having 1, 2, 3 or more criminal arrest warrants or bench warrants, failure to appear warrants, and, a warrant meaning you're to be incarcerated, right? You're wanted for arrest. And so for someone coming into recovery, this is a massive hurdle to overcome to start their life. And I found out, who do I need to speak to bring this resource to the treatment centers? And I did that by, like I said, really getting involved. So I participated in sobriety court softball games, for example. I went to picnics with clinicians and people in recovery where it was a, recovery-friendly event. I went to different treatment centers and spoke with clinical directors, and I sent letters, and I spoke to different judicial officers. I had meetings with judges, and I let them know, hey, would you like to clear some of the warrants that you have open in your community? Because I can do it with people who you otherwise are largely not going to be in touch with, not unless they're arrested. And so let's bring these people in to form some sort of a resolution that's agreeable on both sides. And judges were pretty receptive. I mean, judges have very long dockets, and they're really busy, right. And, they want to get through the paperwork. And if I can help get some of their, what they call like repeat offenders, the people who are in week after week, month after month, year after year, some of these folks have been coming in before this one judge. If it's an addiction issue, this person may have been before this judge a dozen times, right? And so the judge would love to, sort of get rid of this person and get this person back on their feet, right? Because it makes the judge's life easier. And so I essentially was sort of speaking to the choir here. And I said, look, I understand, you have 75% of your docket has some sort of substance use issue, and I can go directly to the treatment centers who are serving the most marginalized of these folks. So the people who are uninsured, they have no medical insurance or are on Medicaid. So they are means tested and have a very low income, right? And so I can go to them and I can directly provide a tutorial for them to speak to you over this platform and potentially resolve these issues. Are you interested? And I'll tell you, the judges were very interested. The court administrators were very interested, and they agreed. We have several courts who agreed to work with us. And so the next couple of years, COVID happened, and so things slowed down a little bit. But once the pandemic health issue, the direct issues of being inside the treatment center, they were reduced over time, and we were able to take public health precautions and wear PPE. Myself and my team were able to go into the treatment centers and meet with people and help introduce them to this, publicly available resource that people really just didn't know existed.
Right. And it sounds like kind of organizing these systems together so that they can work together and flow together in a realistic recovery modality, if that makes sense,
Mm-hmm.
working with the reality of how life operates. And I know that was a frustration for me in working with this, because I would see people come in and, oh my gosh, they have all these legal issues and they really, really wanted to be clean. And they really, really wanted recovery. I had no doubt about that, because I had in-depth conversations with them about it. Yet, once again, these kind of things would come up and it would just sabotage the whole process of recovery. And then once again,
Mm-hmm.
many of these people would end up back in prison over something, to me, in my mind, was like, that's just insane that they're back in prison. They shouldn't be there for that offense, in my opinion. But, it was kind of crazy. They didn't need to be there. And it was heartbreaking to see it.
People with justice system involvement and substance use, misuse issues often come before the court with very high levels of supervision, as I mentioned. And supervision is another way to say probation or parole. And in those cases, they have a lot of check-ins with parole and probation officers. They have meetings. They might have a tether, so like an ankle bracelet.
Yeah.
Location monitoring. They may have restrictions on who they speak with and who they associate with. And, these sort of hurdles can be difficult, if not impossible, for some people who have really limited resources. And so, if your parole terms say that you can't associate with anyone with a felony record, but your family has felony records, where do you live, right? There's so many hurdles here for people who are trying to achieve recovery and abstain from substances or reduce their substance use. So I'm finding that a lot of people are reincarcerated on these technical terms of their parole or probation without actually having committed a new crime.
Yeah, absolutely. It's so hard. When you were working with this and pulling everybody together, it sounds like that it was a really positive response. Like people really wanted to do that. And what was I guess what I'm trying to get here is that sometimes we're just stuck in the system that exists and we don't know how to move out of that system. And so the system just keeps going along, right? It just keeps flowing. And it doesn't help. What was it like to kind of start to change this system and have these people kind of come together to do that?
That's an excellent question, Duane. Let me give you an example. One of the court systems who I sat down and discussed this intervention with, I spoke to a judge who told me that another judge in their courthouse does not really use the internet, right? And so she said that anything that comes online for the specific judge, that she would call him in his chambers and basically break it down over the phone, or she would meet with him in person. And so she said he would be the biggest hurdle to the jurisdiction adopting an online court tool, because he simply, this is not something he's accustomed to doing. He's been here for several decades. He's not interested in learning now. And she said, I like what you're doing. I see the potential benefit for our judicial system and for the community. And she said, I'm going to liaison with him and just make it happen. And so this one individual was, very supportive. And so she kind of took one for the team and took on a little bit of extra work so that the other judge who does not use the internet, and this was, her own admitting that this one judge doesn't use the internet, she said, I'm going to take care of it for him. And so we did encounter situations such as that, where it was so new and so different from what had been done for many years that there was, a little bit of hesitancy or having to change behaviors, but it ended up ultimately working. And that jurisdiction did adopt an agreement to work with us and utilize the online court services.
Wow. Did you find that people, once they started to do this, that they were more open to it and more wanting to make that happen once they saw these, I guess, all these roadblocks and a different way of doing it?
So essentially, when the courts came on, I believe they made agreements for about 1 year with the tech company who had created this software and sold this software platform. And initially, when I spoke with the judges about how the rollout looked on their end and what, has anything really changed and how's it going? Some of the initial feedback I got was very positive and had some unintentional positive ramifications. For example, one of the jurisdictions with a high poverty rate began utilizing online courts to clear warrants. And traditionally, historically, clearing a warrant for someone, an arrest warrant, the person would have to come into the courthouse and bring themselves in upon the warrant. And at that point, sometimes they would be arrested, and other times they might just get a court date or some other sort of resolution. This was a practice that entailed a $50, I think it was a $50 warrant clearance fee. Once this online court was established in this jurisdiction, the judge told me that they actually dropped that $50 warrant clearance fee because of the fact that they didn't have any online payment system set up. So once they started using the online court, the court recognized, we really don't need this $50 fee from people. So we're just going to stop asking for it because we can actually clear the warrant up. And this benefit to our court and to our community is greater than that $50 we would have gotten if the person cleared the warrant in person. So does that make sense?
Yeah, that they saw this, they could see this as a barrier, that it didn't really matter to what their ultimate goal was.
Exactly.
And to be able to let go of this system, change it, shift it, and be practical about it. One of the questions I have is, as you did this, I would imagine this kind of work is so important to people when they're starting to get into recovery, especially early recovery. And why getting rid of these barriers? I mean, I guess in some ways it's kind of obvious, but in a practical sense, why is it so important that we get this right?
It's extremely important in early recovery. When people are entering recovery, especially, the folks that we're meeting with in my intervention, my experiment, they're often just a few days sober and they may be fighting an addiction that's been ongoing for years. And so this is a very sensitive and impressionable time, a very vulnerable time where the individual has sort of come to this realization that they'd like to make a lifestyle change, or at least try to make a lifestyle change. And if something goes wrong and something becomes untenable, their path back to where they were is nearby, right? There's risk there. And so for individuals in this vulnerable position, we want to basically have as few hurdles and barriers as possible to staying in recovery. So if this means, this individual's in early recovery and they're in their first few weeks and they're doing really well, and now it's time for them to submit, let's say they have to submit a job application, at whatever point their clinician and them and their team decide, okay, now it's time for you to start thinking about your future. You've been doing well. And that person realizes, well, actually, I can't pass a job background screening because I have some warrants out. For that person, that could be a pivotal time where they say, you know what, forget it. I don't want to go to jail because if I go to jail, that's going to threaten my sobriety. Now, if we can clear the warrant so that that person is more employable and can support themselves, that is a psychological boost and a material boost to their well-being by saying, look, we've given this person the agency. So they've given themselves the agency, but we've helped them get there so that they can now move forward with their life instead of moving backward, right? So if they've achieved recovery and then they're incarcerated, we know that the clinical treatment in jail is not great, right? If it's even available, if there's programs available, they're
Right,
not
yeah.
great. And it's a really difficult place to try to get and stay sober, right? I mean, jail is, I don't have to tell, I'm preaching to the choir here. I'm sure that it's not a great place to start your recovery journey and feel confident and great about yourself. So if we can help clear these hurdles to employment, this is huge. And then also, of course, hurdles to housing. So one of the things that we hear people resonating over and over with us is that housing is really difficult for them to find because of their criminal justice and civil justice issues. And again, if we can help them get on this path to resolving these issues so that they can pass a screening to get themselves an apartment, that's huge.
And when you say civil justice, what do you mean?
So many of the people we're working with in the recovery centers, they have not only histories in the criminal justice space that you can think of, whether that be, misdemeanor larceny, let's say, or a substance-related charge in the criminal justice system, but many of them also have civil justice issues. And so these could be fairly minor concerns, like a traffic ticket or a parking ticket, that go unpaid over time when possibly they forgot about it, they moved, they didn't pay it. And eventually many of these issues turn into arrest warrants, bench warrants, believe it or not. And so what would otherwise be a minor, tiny little slap on the wrist for someone who could afford to pay off the ticket, you pay the ticket, you send your check in, it's done. For some folks, this can turn into a massive hurdle where they may be facing jail time because of the outlying issues that occur following the non-payment or following a missed court date. And then in addition to sort of traffic and parking violations, we see other things like we have family court issues, whether that be a child in foster care, a child support enforcement case, or a divorce case, housing, so eviction. Some people might have citations for homelessness, foreclosure. There are a lot of ways in which people can get entangled in the justice system. And the reason why it really matters for folks in early recovery, clearing up these barriers, is there are no attorneys provided in civil justice cases the way that, we have a constitutionally authorized right to counsel in a criminal justice case. But in a civil justice case, like an eviction or divorce, we do not have the right to counsel. So for people who are otherwise indigent, they have low or no income, it's very, very difficult to navigate the justice system. And so these fines and fees that accumulate from these civil justice issues and these arrest warrants that accumulate can be barriers that really send people back into their using lifestyle and their previous lifestyle if they just don't feel like they have a way around it.
Do you think that, like you mentioned the parking ticket and, working in this population, I could see how that could be something that seems small to somebody outside of this area, right? Like, well, it's just a parking ticket, just pay it, get it done. But for someone in these vulnerable populations, these are huge barriers that can send people out of their recovery back into using, because it like you said, it just gets bigger and bigger and bigger. And there's with the resources they have, there's no way for them to be able to take care of this kind of stuff.
I'm seeing people come into treatment having hundreds of dollars, sometimes thousands of dollars that they owe to the government in various sorts of fines and fees. And there's a lot written in my field of sociology about government and legal fines and fees. And it's not just costs associated with the criminal cases, but also these civil cases as well. And one of the really big ticket items we're finding for a lot of the parents in our community, of which at least more than half of our patients in treatment centers that we're working with have children. They have child support cases. And in our state of Michigan, a child support amount that is overdue, an arrearage, they call it. Once it gets to a certain level, it becomes a felony arrest warrant in Michigan, or can become a felony. It's a felony charge for being behind on your child support. And so for people in recovery who may have lost their employment because of, related to their addiction, and perhaps they lost their housing, and so they weren't getting letters, and, maybe they didn't update their address timely. These are all sorts of violations of the child custody laws. So if you move and you don't update your address, for instance, these are all violations. And so once you have a felony child support warrant, a felony is a very serious charge to overcome. And so even someone who otherwise has no criminal justice involvement, if they've been using and their addiction has been really taking over how they spend their money and what their lifestyle is, I've seen people come into treatment owing over $20,000, over even higher than that. And so these folks, may or may not have employment prospects. Usually in this case, they don't have employment prospects at this time where they're able to come up with $20,000 to pay back money to the government.
Yeah.
And so we're able to help negotiate with the Child Support Enforcement Agency. There's one agency that collaborates in this program throughout the state of Michigan, and they will work with people who are in acute recovery to help reduce additional fines and fees as long as that person agrees to some sort of a payment plan. And so we're able to help clear these warrants, sometimes felony warrants for these parents, so that they can get on the right track and start paying something that's realistic and affordable to catch up and, start making payments. Some people, they haven't paid anything in years because they, weren't able with that lifestyle they had. And now they want to be on that path. But sometimes seeing an amount like, oh, well, I owe $22,000. That could be sobriety threatening, right? That could be extremely stressful to someone who's underemployed or who earns, $11 an hour. Where are they going to come up with $22,000? And so we feel like we're kind of helping them take that first step to get right with the government and feel like they're clearing up their issues. And this is very supportive. I've heard from the individuals who've participated in this program, they say it's really supportive, and emotionally they feel good about it. Like they're finally making things right so that they can move forward with a very different lifestyle.
So I have another question. So your study is ongoing.
Correct.
What I would love to know is what have you gleaned from it so far? What have you learned from it so far? And what do you think are the most important takeaways that you got from seeing this work?
One thing I've noticed sitting down, and I do a lot of the patient enrollments myself, and I check in with my team when I'm not there to find out all the, initial feedback. And we do take clinical case notes as well, is people largely, almost entirely, want to resolve their legal issues and want to be on what I would call an above the water path. They want to be on the path to being legal. They want to be on the path to see their children, to have employment that they're able to pay taxes. They don't want to be running from the government. And these may be people who have in the past literally ran from police. These are folks who previously lived a different lifestyle, and they are now at a space where they are saying, I want help. I want to move forward. And so it's been really heartening, and I really very much value this feedback I get from people, because it makes me feel like everything I'm doing is the right thing to do, because people do want to make a change. And when I'm meeting with them, I'm at a point in their lives where they're ready to make a change and they don't know how. And so if it's as simple as showing them a website and saying, I hear you, I understand. For instance, you have this felony, you think you have this felony warrant, and, it's been really difficult for you. You haven't been able to work for the past year while you were, living outdoors and not housed continuously. And I get it. And now you're here, and I'm so happy you're here. And let's see if we can look this up. And then I will sit with them and work through the process of making that connection with the government so that they can move forward, for instance. And so, people, the thing is, it's very humanizing, and sitting with the clients and hearing them talk about, wanting to make right with their family and go home and have the family happy for them to be there if they've been away for a while, and really wanting to get back into the economy and really just do the right thing. And I think there's so much stigma surrounding addiction, particularly people who use drugs, but also alcoholism as well. There's so much stigma in the US that it's really, really hidden. And the fact that we come into this intervention at the treatment centers, there's nothing hidden. Everyone there is there because of the fact that they, are in substance use treatment. And so, that we go in there where we are kind of like, we don't care. This is not, to us, this is not an insurmountable hurdle. Like, we are here because of the fact that you are asking for this treatment. That's great. And let us help you connect with public policy, because there are resources where we can help people get on the right path, and they're ready to get on the right path in a lot of cases, right? And, very seldom do we find someone who says, you know what, I just don't want to deal with that. And they have the right to say that too, of course. It's their, they don't have to participate.
Right,
they don't
yeah.
have to work with us. If they say, you know what, I might have a legal issue, but I think I can count on one hand over the past 2 years when that's happened. We've worked with hundreds of people, and almost no one has said, I don't care. Let's just roll the dice and, let the cops come get me. I don't care. I mean, almost no one says, I want to, be wanted by the cop. Like, no one is saying anything like this. If they're saying maybe I'm not ready to deal with it, even, it's less than one hand of people I can count who did not want to resolve their legal issues and get right with the government and move on the right path. So yeah, my big takeaway is it's very humanizing. I mean, these are individuals who have been really in a precarious situation, often for some time, that brought them to treatment, and they want to do the right thing. And so I think that we really need to put aside the stigmas and know that these are human beings and people who want to be part of the community, want to be part of our economy, and they want to be part of their families. And they just could use a little help because they don't have the resources that other people may have, whether that's a lawyer, or whether that's, paying for really extensive high-end treatment that may have substantial resources to get them in the right path, right? I mean, these are people who are on Medicaid or who do not have health insurance.
And like you were saying earlier, sometimes just access to the information of what's going on in their own life. I mean, I totally agree with what you're saying, and that just mirrors my own experience working in this field too. Most people really, really want to contribute, want to be a positive part of society, want connection, want something different, but they may not have the resources. And just the frustrating part, like you were talking about, is just sometimes getting the information they need to be able to resolve an issue.
Absolutely.
That can almost become insurmountable. And it's seems like such an easy thing, but with all of the systems in place, it just seems to block that stuff. And then there's all that stigma where, people are just judged and dismissed before they even have an opportunity to do something different.
Agree. And there's one other thing I keep coming across over and over working with people at this early stage in recovery that I want to make sure that I say, because it's so paramount to the situation, is housing. I hear from people left and right, and they say, they've been evicted, they've been homeless, they've experienced repeat stints with homelessness, couch surfing, just really not having a place to call home. And this is a very acute concern for people in early recovery, because if they have gotten clean and gotten on the right path, but they don't have any housing to go to. That is a very large sobriety threatening concern that they're facing, right? And so I think that from my perspective as someone who is a scholar and someone who is in the public policy debate on the national scale, we need to focus when we're talking about working on America's addiction issues and working on the opioid crisis. We have to talk about housing and how we're going to connect people in early recovery, in reentry from incarceration. How are we going to connect them with housing? Because if people are getting clean and if they're receiving the clinical treatment that they receive, right, which this specific population is already engaged in the treatment, because we know there's a lack of enough treatment for everyone to go around, right? So that's an issue in itself. But for the people who've gotten the treatment and they've gotten to the point where they've started to recover from their addiction, if they are not able to remain housed, how is it expected that subsequent recovery and abstaining or reducing substance use is going to be possible on any long-term scale? And so without addressing the housing issue and the broader, American housing issues that we're facing as a nation with the eviction crisis, this is something that it's very concerning to me, and I'm hearing it resonate. And these are people, again, who have children. These are families who are going unhoused.
Yeah.
And so I think there's really a need for, on the national scale, some policy endeavors that are looking at housing very vulnerable populations. And even if you're, let's say, a legislator who doesn't care about people who use drugs, right? You think about stigma and, that's not my, I'm not worried about that. I'm worried about something else. And so I'm not going to spend any of my legislative time thinking about people who use drugs. Well, think about it from an economic standpoint of how much does it cost? These are families who are on Medicaid. And how much does it cost as a nation for the care for all these individuals? And if you care about costs, then you have to care about housing these families as well.
Yeah, it just would make more economic sense to provide some of these services in this way to help these people become part of society in a way that they can contribute and feel good about it. And it's just, it's a whole huge, you're tackling such a huge social issue. I mean, this is just, in my mind, I'm thinking about it. It's just massive. All of these issues of inequality and vulnerability and in our society that we have to look at. And so with this study, as we kind of get to our time here, with this study, what are you finding and what are some of the outcomes that you're starting to see? And then I know you have another research study, another project that's coming. So I want to hear about that as well. But just with this project and this research, what are you finding?
So one of the biggest takeaways is that people want to get on the path to clear their backgrounds, to move forward, and hopefully using online resources will make that a less stigmatizing and less bureaucratic process that will be beneficial for those individuals and their family, for the community, as well as from the government side. Resolving criminal justice and civil justice issues is always a good thing for the courts. And so why not try to do it as efficiently as possible? And we saw with COVID that accessing courts in person became very difficult, if not impossible. And so using online resources, particularly ones that are free, like in this case to the user, it's free to use these resources. This is a no-brainer. It's a nonpartisan no-brainer. I mean, you look at it and these are people who need assistance and they can't afford attorneys and nobody's giving them an attorney. So why not clear these issues so that they can better access housing and work so that they can stay on their path to recovery? And hopefully that will reduce recidivism in the future, right? Reduce incidents of them potentially becoming involved with the justice system later. And again, as I just mentioned, housing is a major issue. And so I think we need to tackle that if we care about Medicaid spending and we care about poverty in America, we have to think about housing and what that might look like for this population. And if we need to do some more evidence-based research on things like transitional housing as an option, for instance, that's something that I'm seeing used a lot in our community. And it seems to have a pretty good success rate in helping people stay on their path to recovery. And then I do have another research project that's coming up, somewhat related to this study. And I'm working on an invention with engineers in Ann Arbor, Michigan. And we are doing something that's going to hopefully improve health equity for individuals who are under government supervision. And that's going to help connect people with resources outside of the carceral state, using software and hardware that improves upon what the government uses currently. And so that's coming down the pipeline and has a little bit of support from the National Institute on Drug Abuse. And so looking forward to seeing what comes about with that as well.
Wow, Meghan, I am just in awe of your work and your passion to do this work, because it just sounds like you pour your whole heart into it to really help all these people, and you see the goodness in them. And I just love that. Usually at the end, as we get to the end of the podcast, I like to ask one question. I'm going to ask it a little bit differently, but for maybe someone out there that has some ability to change these systems or take on these efficiencies, and you could tell them one thing and you'd want to say one thing to them, what would you want them to know? What would you want to say to them?
I think one of the biggest issues with our justice system that makes things extremely difficult for people who lack resources, so people at the low end of the income spectrum and people who have barriers to accessing courts, whether that be a mobility issue, for instance, or a substance use disorder. So people who really have justice system issues but cannot access the courts because of their own limited access to resources, inability to pay for lawyers. I think the justice system could improve upon how they administer their practices by sharing data with each other and by having cohesive systems that talk to each other. So having civil justice and criminal systems that talk to each other and link up case files so that individuals don't have to go to, 8 different courts, for instance, for someone in recovery who may have been using for many years and have multiple issues outstanding. If the courts could talk to each other and not be so siloed and take advantage of software systems and online systems that have secure servers so that you can protect people's information, just so that you can more effectively serve the public and do so in a timely manner that's more conducive to efficiency and public health benefits, particularly for someone, for instance, with, substance use issues, that they can get on their feet if the justice system moves a little bit faster.
Thank you, Meghan, so much for coming on to the Addicted Mind podcast and sharing all this and doing this work. I just think it's just so important. Where can people find you and find more about what you're doing? Where can they go? Thanks,
Duane. I have a website, www.meghanoneil.org. It's MEGHANONEIL.org. I'm also going to be going over to Ohio State Drug Enforcement Policy Center, so I'll have an email starting there in a couple of weeks. For now, my email is Meghan, MEGHANON, @umich.edu for University of Michigan. And I'd love to hear from people and hope to continue this discussion on the national scale in the academic and community-based space.
Thank you, Meghan, so much for coming on and just sharing all that you're doing.
Thanks, Duane. I appreciate you having me. Thanks for giving me this opportunity.
All right. Thank you for listening to the Addicted Mind podcast. As usual, all the show notes will be at theaddictedmind.com, so check them out. There, you can get a link to Dr. O'Neil's study, so check it out. And if you've enjoyed this episode, you find it valuable, share it with a friend. And don't forget, can join our Facebook group. Just go to Facebook and type in the Addicted Mind Podcast, click join, and also follow us on Instagram at Addicted Mind Podcast. All right, everyone, have a wonderful day, and I will talk to you on the next episode.